Time is flying, period. I
It
don't know
is
where it's
flying.
going, but it's flying.
It's flying. And I chuckle because as I think as kids, we always be like, hey, it's taking
Hmm.
forever. This, that, and the third. Da, da. Now it's like it didn't come and gone. Everything has come and gone. And this year is almost over. And
Yes.
we sliding quickly into the fourth quarter of 2026.
Hmm.
Imagine that. Imagine that. Wait, let me put on this focus for people to be disturbing my groove. All right. Wait a minute. I saw this and I wanted to put this on. No, I'll wait. I'll wait because I'll put it in with the um when we start for real. For real. Okay. But how was your week?
It went by like this. And I'm not upset about that part, but
I hear you. I hear you. It's like, woo. Did you
how about
attend
yours?
the town hall meeting at
I
all?
didn't even know they had one.
There was a it was a brief. I came late because I had another meeting. Um, yeah, so I missed the whole thing. But there's some new. I heard new branding stuff, maybe logo stuff. I'm like,
That's the least of their worries.
I'm glad you said it. Thank you. Like, really?
I
Unless
don't
it's
think.
unless it's putting all HC Pro colors and stuff in the
Oh, see now that I
background.
wouldn't be surprised because Lord knows we don't need another mug or tumbler.
I cannot. Oh my God. Okay. we, now I'm tickled. With that, we are going to get started. So, what happens when the exact words you wrote in a medical record are read back to you years later in a courtroom and they don't mean what you meant? Welcome to the Saturday Morning Tea, where we brew up the hottest topics in healthcare. And each week we cover health information, news, education, how these weeks are flying by and time is just flying by into the future. Time keeps on ticking into the future. Certification tips, entrepreneurship, and revenue cycle at large. And if you are new here, go ahead and hit the thumbs up, hit that like, and let's get into it. If you're returning, you can do the same. Thumbs up and like button, please. I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, a healthcare compliance consultancy located in Cincinnati, Ohio, specializing in revenue cycle, regulatory compliance, and education. Before we get into today's topic, let me ask you something. If a courtroom pulled your last 10 notes tomorrow, would they say what you meant or just what you wrote? So, if you're working toward becoming a certified marketable medical coder and want a clear, plain language path to get there, check out this information on a free email course. Free, yes, free 99 email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified, marketable medical coder. Learn more at bit.ly/5stepscoder. Okay. And to get more information about the 5 steps to become a certified marketable medical coder, check the video description for the link. All right. Joining me today is my partner in success, my co host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, go ahead and introduce yourself to anybody who's new to the room this morning.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I've been in healthcare for a long time. I left the bedside in 2014 and moved into risk adjustment. Um, In 2020, I created a company, the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
And how is that working out for you?
It's coming along. I started a new class Thursday.
Okay. Everybody still happy at the
Yeah,
beginning of
so
the
far,
class?
yeah, in the beginning, it's
It's
always,
usually around that week 2, week 3,
yeah,
where everybody get the
yeah.
big eye. At least in
Hmm.
mine, it was like,
Yep.
what? Some of that new warm fuzzy feeling wears off.
Hmm.
It's like, yeah, it's time to dig in, dig in. All right, all right. That's good. That's good. Okay, so while we're talking, you can drop your comments and questions in the chat. We monitor, we're looking, we're trying to make sure we're getting all of the things. But if you have a question for us, please place the cue first so we don't miss it while we're moving through the material. So, whether you're joining us live this morning or catching the replay later, today we are asking, what does a real, currently unfolding criminal trial in Massachusetts have to teach every one of us who touches a medical record about how we document and who might be reading it years from now? But first, before we still spill the tea, let's look into our church announcements, shall we? Shall we kick it? Yes, we can. Hey, 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 hey. Oh, 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 oh. Hey, hey. All right, all right. You know the guy from the Five Heartbeats passed away. Look, that's the only thing I know him as.
No.
Nights like this, I wish that raindrops would fall with the bang.
Mm. Oh, wow.
Look, that's all I know. I don't know that man's name. I don't know what other movies that man may have or shows that man have been. All I know is that I saw it all over.
That's a great song. And After Seven did a great remake.
They did. They
They
did.
really did.
They did. I was like sad. I was like, oh, I'm gonna have to find some time to pull out the Five Heartbeats out the crate. Check them out. All right. So, okay, I'm gonna turn this down. Okay. All right. So, just a couple things. You know, our PRN hot tea sippers and PRN elite. Again, your Patreon tiers are live at bit.ly, the PRN tea sippers. Again, you can find the link in the description if you're interested in what's happening and what kind of things they're getting. So this week, the hot tea sippers drop includes a quick reference card and an episode quiz built around today's topic. And then the PRN elite members, you can look for your executive briefing with a 90-day documentation audit roadmap. And a reminder that our church announcement segment will be tracking and looking and paying attention to that patientrightsadvocate.org lawsuit against the AMA, the American Medical Association, over the CPT copyright, and that we will continue to follow any rulemaking from CMS coming out of that calendar year 2027 physician fee schedule and outpatient prospective payment system cycles where that RFI. And don't forget, I believe the outpatient prospective payment system comment period ends Monday, August 31st. And we got a little time until September for the physician fee schedule one. So if you're looking to comment on any of those, either go back and check out our previous lives to see what we're talking about, and or click on the link so you can go through and see what information they're looking for commentary on. Again, we will be monitoring these as both of them develop. Mr. Jesse, you have anything?
No, I'm really just This topic is going to be interesting.
And it just fell into my lap. I want to thank, I don't even know the lady's name, but it was something on LinkedIn, and I couldn't stop. I said, oh, let's begin the research. Let's find out what she's talking about. What is the what? Who, where? It came up in my feed. All right. Let me get this banners down. Boom, boom, boom. Mm-hmm. Okay. Get rid of this too. All right. So, I think we got everything. Let the tea sipping begin. All right. Good morning, and welcome back to the Saturday Morning Tea, where we serve up the real talk our profession needs. I'm Clarice, and that's Mr. Jesse, the coding nurse, and we meet every Saturday morning to break down what's happening in health information management, coding, compliance, and revenue cycle. In plain language, you can actually use Monday morning. To everyone who keeps coming back week after week, thank you so much. All right, get your cup. Again, no judgment about what may be in your cup, and come on in the room. Now, I do want to set this this whole scene, because actually this is kind of heavy, and I want to handle it with care. So this particular trial involves the deaths of 3 young children and a mother's documented serious mental illness. And we are not here this morning to litigate guilt or innocence. That is the jury's job, not ours. We are here because buried inside weeks of very difficult testimony, there is a moment that every single person in health information, coding, auditing, or clinical practice needs to sit with. Here's the current status of this, or at the current status of this recording. The case is Commonwealth versus Lindsay Clancy, being tried in Plymouth Superior Court in Massachusetts. Again, as of this taping, the trial is still ongoing. There is no verdict yet. The prosecution rested on August 17th, and the defense is presenting its case now. And the judge has indicated closing arguments are likely early this week, but I don't know if they actually began or not, or coming this upcoming week, August 24th. So we'll see. If a verdict comes down after we record this, we will update you if necessary in the church announcements. But I wanted to also just show this particular, because this tickled me all morning. The Law and Order HIM edition. I felt like doing the do.
Yeah.
If I would have saw it earlier or thought about that earlier, I might have would have tried to find some of that music. So thank you for that. Thank you for that chuckle, and welcome. I was tickled. Like, here we go. All right. Because I guess it could have been that wasn't the purpose. But it does fit. It does fit. I love the folks on the internet. Folks are just comedians. The knowledge and skill set of those of you who are on as they call it, Beyonce's internet, are just amazing. Okay. So on August 10th, 2026, one of the treating psychiatrists, Dr. Jennifer Tufts, was on cross-examination. Defense counsel had her read from her own clinical note from an October appointment back in 2022. Y'all know it's 2026, right? Okay, so you see that span in time. The note said, quote, "not hyper pressured speech," end quote. Now, pressured speech, meaning fast, urgent, hard to interpret speech, is a recognized sign of mania. Actually, what did I just see? I was reading the book by Kennedy Ryan. Is that her name? One of her most recent books, and she was talking about it was eye-opening for me, and it was a little emotional for me too. But she was talking about bipolar conditions and the mania side. And part of this information was in that book. That's why I'm like, wait a minute, I just read about that, about how when they're either approaching a manic episode or in a manic episode, there it's like one long run-on sentence. They're just da 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 da, and then they may repeat that over and over and over again. But anyway, so that's what this pressured speech indicates. So the defense counsel's position was simple. Your own note says the patient had pressured speech. Okay. Dr. Tuff's position was that she meant the opposite, that the patient's speech was not pressured and that a word was effectively missing. Here's how it went. And tea sippers, I want you to really hear this exchange because it's short, but it says everything. So the defense counsel said, when you wrote this, you did not say not pressured speech. You said in the medical record, pressured speech. Dr. Tufts responded, she did not have pressured speech. Then defense counsel pressed again. And Dr. Tufts said, I don't care what it says. I know what I meant. Defense counsel asked, did you write that, doctor? We could sit right there all day.
All day.
All day.
Well, mic drop.
A mic drop. And Dr. Tufts answered, I wrote that, but you're misinterpreting my note. She also testified, according to the Boston Globe, that the interpretation being put to her was, quote, incorrect, end quote. Sit with that for a second. I don't care what it says. I know what I meant. As a clinician, I understand that instinct completely. We all have understand what they mean when they do that. You're in the room. You know your own shorthand. You know what you were thinking when you typed it. But tea sippers, that is exactly the problem. And it's the whole reason we teach documentation the way we do. All right, let's talk about how a single missing word turns into a courtroom exchange. The note read, not hyper pressured speech. Dr. Tufts says she meant not hyper, not pressured speech, essentially, that neither sign of mania was present, but as written with a comma, because it was a comma, instead of a second not, it reads as a description confirming pressured speech was present. This is what can be called the omitted negation problem. And it is one of the most common and most dangerous patterns in clinical documentation. Negation words, modifiers, and compressed phrase lists are exactly where ambiguity hides. When you write findings as a quick string of descriptors separated by commas instead of complete sentences, you are trusting the reader to guess your grammar. Years later, y'all see how many years we got here, a defense attorney, an auditor, or a payer is not going to guess in your favor. They're going to read exactly what is on the page. And here's the deeper lesson, tea sippers. Dr. Tufts was not wrong that she knew what she meant. She almost certainly did. But intent does not travel with the record. The next reader, whether that is another clinician, an auditor, the OIG, meaning the Office of Inspector General, investigator, a payer utilization review team, an attorney, or a jury, only has access to what you actually documented. Not what you were thinking, not what you meant, what you actually wrote. Mr. Jesse, you know to jump in at any time. Now, this case is about far more than one sentence. Multiple types of records became central evidence in this trial, and I want to walk through them because every one of them is something you touch in your own work, especially if you're in behavioral health. First, telehealth notes. All of Dr. Tufts' appointments with this patient were conducted virtually. 14 sessions, all telehealth. Second, patient portal messages. Messages exchanged through the MyChart portal were read into evidence, showing the patient describing her symptoms in her own words between visits. Third, prescription records. Testimony established that this patient received somewhere around 30 prescriptions across roughly 4 months from multiple prescribers, covering more than a dozen distinct psychiatric medications. Dr. Tufts alone wrote 12 of those prescriptions. Fourth, and this one is newer territory for a lot of us, the patient's own phone diary entries were extracted by digital forensics and read aloud in court. Here's what ties all of that together. Every one of those records were created for a clinical purpose, to document a visit, to communicate with a patient, to support a prescription. None of them were created with a courtroom in mind. And yet, years later, every single one becomes part of the legal record. There's one more piece I want to spend some real time on because it's a health information issue at its core and not just a clinical one. Dr. Tufts testified that she did not have this patient's complete medical record and that she never obtained records from the patient's other treating clinicians. That includes a psychiatric nurse practitioner named Rebecca Jolada, who was treating the same patient during roughly the same window through a difficult health systems behavioral health. I'm sorry, through a different health systems behavioral health program. Here's where it gets even more important for our purposes. Nurse practitioner Jolada's own documentation and her own testimony described observing pressured speech as one of the several signs she considered consistent with a possible bipolar or hypomanic presentation. So now you have two treating clinicians seeing the same patient in the same general time frame, and one clinician chart says, as she intended it, speech was not pressured, while the other clinician's chart and testimony describe pressured speech as an actual finding. Neither clinician had access to the other's notes. Neither had a full picture. And when both charts eventually sat side by side in a courtroom, they told two different stories about the same patient at nearly the same time. Dr. Tufts also testified that privacy law, HIPAA, meaning the Health Insurance Portability and Accountability Act, prevented her from contacting family members without a signed release, and that she never obtained one from this patient. T-Sippers, this is not a criticism of any one clinician. That is a systems problem. And it is exactly the kind of gap that health information, care coordination, and release of information processes exist to close. When records don't talk to each other, clinicians can each be doing their job well on paper and still be working from two different versions of the truth.
Now, what I want to know is how many provider programs, how many MP programs, how many PA programs, how many medical schools are using this case and talking about it like we are?
I hope they are. Ooh, I hope they are.
Because
the I'm sorry, I mean to cut you off. The LinkedIn post that I saw was not from a clinician.
Because this is a case study for the ages. They will be talking about this case for years. And if these schools are smart, like that, no, somebody better be organizing a Zoom to have a conversation.
Right. Some kind of something. So, I mean, and you know, really, we've talked about this over and over and over again. As we all know, as health information professionals, all we have to work with every single day is the documentation. That's how our work begins. The clinician's work begins with, the patient and providing the service with the patient, but then finalizing that work with the documentation. And then that's when it begins the rest of the trail of what happens and what occurs. Go ahead.
And the thing is, like, I know I've done it. I have written in nursing notes and left off a word, and you read it back. Oh no, that's not what I meant to say, because not having and having means two totally different things.
Absolutely.
And I mean, I've done it in nursing notes. I've done it in denial letters. That's why you really have to go back and you have to take your time and read. I mean, yes, that is, and a lot of times, when you're busy or you're behind, you just, typing
it out.
Exactly.
I've done it. I've gone back and looked like, what did I just say? That was not what I meant. And then I'd be like, my bad. I meant da 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 da. And don't do something, on these newfangled smart machines, because they'll auto correct you all wrong. Like, that's not what I said. That's not what I typed. That's not, So it's you have to really be mindful and be careful. And I think the key thing is, yes, that documentation is for you as the clinician who is going to see this patient, but you also have to know and have to be mindful that you're not the only person looking at this documentation. So it's not only for you, it's for the world. It's for all. Anybody that has any type of dealing with that particular patient. All the different hands, all the different places. And of course, hands that are supposed to be looking at the documentation, not just willy-nilly folks, just out there. That's a whole other episode. But those who are supposed to be looking at this documentation. And, that's where CDI comes in, because oftentimes they have to try to interpret what, and you can't code and or bill off of interpretation or what you thought or what you meant or we only have that record. And again, physician, clinician, whomever can be long gone when the auditors come to be like, you know what, we trying to see something. We trying to see something. Send us all of these records from XYZ provider, or send us all these records from XYZ patient. We trying to see something. And all you have is to send you. There's no cleanup. There's no correction. Send their records. Send the stuff. So that whole, I know what I meant. And I didn't go back and look, but I feel like, she might have said it 10 toes down with her chest. I know what I meant. Really?
But guess what? But it don't matter. That's not what you wrote.
What did that prosecutor say? But did you write it, doctor? Did you write it? Ooh. Yeah, when I saw that, I was like, this is truly not only a case study for us to see and even have the conversations. If you're in positions where you are providing education to providers or clinicians, use this to explain to them. See what happens when you don't document appropriately. Right now, you may not necessarily be in any type of trick bag. However, it could occur. Here's an example where it could occur. And who would have thought years later, 4 or 5 years later, that now your documentation is being scrutinized. And now it's all over the world, because it's all over.
All over. Yes. Everywhere.
And because it has become a high profile case, not only for, what it is, but just with this whole case study of documentation and the clinician's documentation. Like y'all done made this even bigger than what it maybe had started out as, right? But so it's real important. It's real important that those of us who may be providing education to providers stress to them, this is not just for you. It's for you, but for others as well. And so make sure that it's readable. Make sure you're saying in ink what it is that you're thinking. I remember, I think it was a little slogan, think in ink or whatever, way back when. Make sure you were putting that information down. Even though they're not necessarily in ink nor. Or the other thing is, and I don't know, they didn't mention any of that, but that whole copy cut paste foolishness, make sure what you copy cut and paste in actually is current to what is going on in the encounter that you see in the patient, because things can change on a dime.
Mm-hmm.
Are you catching that? Are you just trying to? And I know there are other external forces around some of these things, like the pressure to get through all the cases and the pressure to go back in documentation and the pressure to remember what it was and what happened and da 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 da. I get it. I get the production component and the pressures that those things place on this. And it's that pressure is not even just on the clinician side. It's the pressure even going downstream, because we're pressured to make sure we get this coded in a timely fashion. And we're pressured to make sure the bill goes out. And we're pressured, all of that. But even when you are doing your job of reading the information, if you see something, say something to somebody. Even if you're a little timid person and be like, oh, I'm scared to talk to the doctor. Tell somebody who can and will. If there's a question about something. And again, there should also, well, and I don't know if that exists too, some other type of stopgap where maybe clinician to clinician, somebody is like doing a cursory check of, like, do they have quality assurance people for the providers to kind of look over their notes? I don't know if that exists unless you are in some type of training or being supervised. I don't know if that exists. I think folks are just wilding out and doing what they do at a certain level.
I agree.
So we're the ones that's actually seeing that note again and maybe reading it. Like, what? What did I just read? And y'all know we're gonna read. Sometimes we have to read them notes 3-4 times, even the typed ones. I know it. We probably had to read it 10-12 times when they were written.
Yeah.
Sometimes we gotta read it 3 or 4 times. It's still a thing. Yeah. So here's what I want you to walk away with this morning. And this is pretty much the recap. So number 1, intent does not travel with the record. I know what I meant explains you. It does not explain your chart. Number 2, watch your negations. A missing or misplaced not can flip a normal finding into a symptom. Write mental status and behavioral findings as full, unambiguous sentences, not compressed phrase lists. And this is not just limited to behavioral health findings. This are all findings, because a symptom is a symptom. Somebody could be diagnosed with, I think I heard something about that too. Somebody was diagnosed with uterine cancer, got a hysterectomy, and come to find out the person didn't have cancer at all.
Mm-hmm.
Because of a documentation blip. Like, be mindful, be careful, be intentional. Number 3, every note has a future reader you will never meet. Period. An auditor, a payer, an attorney, a jury, or a colleague who is picking up your patient for the first time. Write for that person, not for yourself. Write for the person who's going to be reading this down the line. Make it crystal clear. Number 4, fragmented records create fragmented care and fragmented legal exposure. If you are treating a patient someone else is also treating, document your attempts to get their records and document the barriers when you can't. Because clearly, not only is this trial about guilt and innocence, but buried in here, you got 2 people saying 2 different things who supposedly saw the same patient during the same time frame with the same specialty. Don't hit me with the one's a psychiatrist and one a nurse practitioner. If that comes up, I swear to God, I'm gonna, I'm gonna lose it. Because somewhere in my spirit, I feel that may come up.
I was going to say, hold on to your hat. Hold on.
Right. Because I feel like that may be a thing where someone wants to assert their authority based on the titles that they may have. But clearly the information is in the documentation. I mean, they put her on how many medications? Like something was going on. Something was going on.
But you know what this should also put a spotlight on, and just like you said, we're not even going to, litigate, but what I know and what I've said on this platform, for off and on for years, is that this country does not take mental health seriously. And there are not enough resources. You have people who are non-compliant with diabetes. I read it every day. People with A1Cs at 13, 14, 15, blood sugars at 1,300. And the level of care they get is different than somebody who says, I don't feel like myself. The answer is not, oh, well, go for a walk. You don't tell diabetics, oh, well, go for a walk. No, you treat them.
And also the other unspoken is the barriers to access of these mental health professionals, not only from the patient side, but from the mental health professional side. The amount of things that they have to do and hurdles and paperwork and all of the things that they have to do to be able to now provide the services for care for people with insurance. I mean, if you got the funds to self-pay them, then it don't apply. And for years, a lot of people were just only accepting self-pay patients because it's enormous. It has gotten so bad that we talked about this, what's happening here in Ohio, that they have put a pause on new certification applications because of there's so many people that are wanting to get in this field and help and do, but the folks who have to certify to make sure that they are who they say they are, bringing the license that they say they have, having the skills that they say they have. One, they have a shortage of people. There are not enough people who can do the work. And two, they didn't build the foundation to accurately monitor this. They didn't put together their whole compliance toolkit to assist them in doing the work that they're supposed to do in validating and verifying all of these things. So a lot of folks went straight through the cracks and been doing all kinds of things. And now you chasing when you could have stopped, when you could have prevented. Well, because because the feds have come down and like, well, excuse me, ma'am and sir, what did y'all do? Now they trying to, it's a cleanup game. And in the middle of that cleanup is now this pause. So no new people can get certified. While you got people out here who need all kinds of services for all kinds of people with limited access to people who can do it. It's a mess. It's a mess. And again, to your point, I think if these conditions, if mental health as a whole, behavioral health, mental health, even substance abuse, if all of this was more important to those comparative to medical conditions, then maybe this would be a different conversation. Maybe this would be something different that folks would advocate for. And I do see advocacy. I'm not saying I don't. I do see advocacy around.
It's not, but it's not on the same level.
It's not on the same level. And it's relatively recent advocacy because y'all know back in the day, y'all had Uncle so-and-so or cousin Joe up in the attic with the TV with the money in it. Y'all know, and cousin Joe wasn't always 100%. You didn't know what was going on with cousin Joe, but something was up with Uncle Joe or cousin Joe. Something was up.
And people wrote off Uncle Joe as well. He ain't been right since the war.
He ain't been right. And putting other things on. He went to Vietnam, or this, that, and the third, whatever. Well, nobody has talked to Uncle Joe. Nobody. He hasn't been treated clinically. Nothing. In that same book that I was reading, which was an eye opener to me, especially about being bipolar. It's genetic. It's hereditary. That I did not know. It's a hereditary condition. So the story is about a girl who ultimately learns that she has bipolar and how to manage and da-da-da-da-da. But her early interaction was her parents. She was 10 years old, and her father used to pop off on a regular basis. And, they would think of it as, he tripping, he mad about something, he whatever. Would pop off all the time on her mom. And this last time, all of the things that she learned from going to therapy or whatever were textbook to what he did and he was just all of the symptoms, all of the things. And no one knew. He never got treatment. He never saw anybody. Some of this could have been avoided because he ultimately, he was arguing. The mom would recognize stuff and it's like, you need to talk to somebody. You need to, and he was like, no. And so they were tussling because he was taking the phones and breaking the phones because he felt like she was cheating on him. And she was like, here we go. Like, this would be a regular occurrence. He was always, fixated on that. And she was like, why? I'm still here with you, whatever. Anyway, she was taking the phones, throwing the phones, breaking the phones, whatever. And she reached to grab for him, like, you need to call. And he pushed her and she hit her head on the edge of the table and ultimately died as a result of that trauma. And when he realized that she was down in the blood or whatever, he stopped, he grabbed her, he took her outside. He was, he wouldn't let, eventually people came, the paramedics or whatever, and he wouldn't let them get to her. He wouldn't let them, he was in a manic thing. And they had candles going and the house caught on fire. And when he realized that she was gone, he ultimately ran into the fire. And so both of her parents at 10 years old were gone at the same time. And she never really said what happened. She just said both of my parents passed away. She would never really go into it until she then, and they said normally this happens around college age to people when they first start exhibiting their symptoms.
And schizophrenia too.
Yes. Mm-hmm. That she flipped out a couple of times in 2 different college campuses. But when she started, she went to get help. Like, what is wrong with me? What is going on? And so she actually had to tell the therapist about her father and find a way to ultimately forgive him, because she did not. But he never got the treatment or the help to help him do whatever. So it was a great story. It's rough getting through, but it was a good story. All that to say, that there's so many people out here who may need to get treatment, but there are barriers all around. And to your point, that because it's not taken seriously, people don't know, or people don't even talk about it. Like I say, some of the stuff I'm reading for the first time and I didn't know. And even with my son, he was bipolar. I didn't. I knew he was. What was ringing the doorbell? I knew he was. Oh, that's my neighbor. I knew he was like, somebody is ringing. Don't they know I'm online? I knew he was. We got the bipolar diagnosis a year and a half ago in 2024. But I didn't know what all of that entailed. And I would see different things or hear different things and be like, what? And now in hindsight, reading this book and reading all of the things, I'm like, oh my God. So there's a lot, even that, lay people don't necessarily know. And you may or may not be, or may be living with somebody who may be experiencing some of these type of things. And you're just chalking them up as, oh, they drinking a lot, or, oh, they doing this, or, oh, they doing that. And it may be something more serious. So I'm with you. I would hope that there would be more advocacy, more things. And especially with men. That's a hope. We done went all the way off topic, but especially with men. Especially with men.
And let's dig a little deeper. Black men,
especially with black men. Like, it's okay to talk. It's okay to talk to somebody. You don't have to keep up the hype and the bravado with your friends all the time. Sometimes it ain't all about all of that. Sometimes it's just, just get it out. Y'all take in so much. Y'all have so many pressures, and y'all have so many things that y'all dealing with on a day-to-day basis coming at you from all angles. It's okay to talk, because sometimes that stuff bottled up is killing y'all. The stress, the anxiety, all of the things. And then self-medicating those things is making it worse. It's making it worse.
Way worse.
Okay, I'm sorry. Number 5. This isn't about writing a defensive chart to protect yourself from a lawsuit. It's about writing a clear enough chart that the truth survives, whether the next reader is a clinician, a coder, an auditor, or in a case like this one, a jury. And that, tea sippers, is why it could all be so simple. Once your documentation says exactly what you meant the first time, with no negation left hanging and no reader left guessing. This was a good show.
Mm-hmm.
Doom. Mr. Jesse, do you have any closing thoughts on this one?
No, I agree. This is really a good show. And whose commentary about this I would love to hear is Nancy Grace.
I wonder, has she? I wonder.
Because
I didn't do like internet searches for people. I went to the news sources. That's where I got my stuff from. So.
I haven't heard anything about Nancy in this case, because Nancy is currently fixated on Nolan Wells. So,
and I'm glad somebody is.
Yeah, because when I tell you, when it comes to an attorney, God forbid, if I ever get in trouble, I hope I have money I would pay. Nancy Grace is the type of attorney anybody in the world would want. Because when I tell you, that woman is like a dog with a bone. When she gets fixated, she don't let it go. Because I'm sure if she could relitigate Casey Anthony again, she would. That woman dragged Casey Anthony for years.
I'm gonna be curious to see. Like, have you peeped in? Did you look at this?
No. Hey, girl.
Hey, girl. Can I slide in your DM? Yeah. Oh, she said, I don't. She don't think she started on the Clancy case yet. Yeah, well, to Mr. Jesse's point, she busy. This Nolan Wells, baby. Well, look how we can build, which was my love, because once upon a time I did want to be an attorney. But that's why I love compliance so much, because it was medicine and law was my two things. And I'm always, because even still to this day, I'll be thinking I should have just go to law school. But I'm an old lady now. I really got the time.
I thought about that too, because this is a true story. I have a cousin who, and I was a teenager, and I was like, even as I knew something was wrong, and her case was she had, I think, 6 sisters. They were all molested by their father. She got pregnant and had his baby. She killed the baby. And they put her in jail. I was like, I don't think she needs to be, I don't think she needs to be in a mental institution. I don't think that's murder. I don't. I mean, you have been violated and you have to, oh my God, you have to,
That's
you,
a lot
mm.
to unpack.
And as a teenager, I was like, that is not right. Like they doing her dirty. That's the only time I ever wanted to go to law school. The only.
Mm. I don't know. I and compliance does that for me. It feeds my law need in medicine. So it feeds both sides for me. But yeah, I thought about it. I was looking into, the LSAT and all of the things and talking to people and all of yeah. And I thought they have like a master of law, some. I thought about that too. Like, well, maybe just go this route and do something else. I don't know. I mean, I feel like they're fewer summers ahead of me than they are behind me, but maybe there's enough to get through. There may be enough to get back. Who knows? All right. Well, with that, this was I do think this was a great episode. And that is our tea for today. Remember, it could all be so simple once your note says what you meant clearly enough that it doesn't need you in the room to explain it. Yes. I'm Clarice Warner, the girl with the pearls. Be safe, be kind, and don't wish for it, work for it. Until next time, take care and have a great weekend. We will have I do have somewhere to go this afternoon or this morning, but we will have some time for meeting after the meeting. So I'll see you guys at 10:15.
All right. I got to be brief too, so that'll be perfect.
Yeah. Cool. Right. Real brief. All right. Thank you. Oh, I guess I need to say this. No, I guess I don't have to say this, but I will say, for any viewers that need mental health support, the 988 Suicide and Crisis Lifeline is available by call or text 24/7. So if there is a need, please reach out, talk to the people. All right. Have a good weekend. See y'all later. Bye.